they're considered holchei drachim, oiskim b'mitzvah, they're working. They're not mechuyev to go out. In fact, they compromise their availability. A person is not supposed to compromise their availability. It's a meila in their pu'ula, and they're working, and they're supposed to be working. There is a difference between the first night, where there's a chiyuv, and there, even if you're talking about misham she'en shel choilin, but if you have the ability to go out because you could have somebody watch your shift, because you could switch with someone, or there's enough manpower on the floor and you could slip out, and you go out and you eat the shir in the sukkah, you make the bracha, and you come back. But the rest of the days, there is no chiyuv like that, and your focus has to be the work that you're doing. Women should be matriach on the first night. Again, it's a lower level chiyuv. If it's possible for them to go out and to quickly be mekayim the mitzvah, yeah, Ashkenazim even make a bracha leisha for women, so it would be a nice thing. But again, everybody has to weigh. Their obligation to their job comes first, especially if they're in ICU or PICUs or different units which clearly rely on them fundamentally. So then even a man wouldn't be mechuyev. A man would have to focus on his job. So yeah, it's a step lower. The rest of the day they shouldn't focus. The rest of the time they shouldn't focus on sukkah. They should focus on their job. And when they go home, if they can, they will partner. They're partner. I can't say that for a man it's not a hidur. That might be a nice thing for him to eat proteins and fruit and vegetables. A person could eat full meals without having to make a mezainis and obviate his chiyuv yeshiva sukkah. That might be a very nice thing. I would recommend that. When a person's coming to the hospital and he realizes he's not going to be able to sit in a sukkah and he has to eat. Yeah, I don't think this is the hedyot that the Yerushalmi is referring to. Kalapatim midavav v'iseu nikra hedyot. This is a person struggling to try hard to keep the mitzvah sukkah. If he needs to eat, he eats. If he needs to,
and you should do the suda properly. Meaning simdas yontif is my question.
Yeah.
Okay.
I think it's a case by case in that situation. If a person could trim a minute from the beginning and the end of his suda to make it to the sukkah, then of course he should go to the sukkah. I think it's case by case. I don't think you could just say he has break 10 minutes. I think he should utilize it for the sukkah. Yeah, that would make sense. The Shulchan Aruch says that Kol Shiva Sayamim Koirei B'techa Sukkah Ukeshemevinu Medaktik B'Meshi Yikra, provided that the sukkah doesn't compromise his ability to learn and his ability to think, right? Mishnah Berurah explains that if it's difficult for him to sit in the sukkah, there's overhead noise, he's not able to learn, then go into the house, right? So you see that the concept of tsar is, if the sukkah and the environment of the sukkah is going to cause him difficulty, then, but let's say a guy has canker sores, or a guy has, wherever he is, he's going to be in pain. Unless he needs a bed, he's going to be in pain, right? He's going to be in pain, so what's the difference if he's in the sukkah or in the house? He goes to the sukkah.
Okay.
Right? A guy has a broken arm, and he's in a lot of pain. He's taking painkillers around the clock. But the sukkah doesn't affect his pain. They say Epsamaisa with Rav Chaim Ozer, it's a little bit of the reverse concept. But he was sick and he wasn't using the sukkah 1 year, and then he had company and they came and he showed them where the sukkah was and he was going to go in. And then they saw him come out with his food. And they asked him, aren't you potem? Mitzvah is potem in a sukkah. He says, yeah, mitzvah is potem in a sukkah, but not from achnasas orchim. And part of achnasas orchim is sitting with my guest. So while the tsar over here would provide me a p'tur for sukkah, didn't provide me a p'tur for sitting with you. And if you're mechuyev, I'm mechuyev. The meter that is used sometimes, I heard Rabbanim say that if it's bottom of the ninth, it's the World Series and your team is winning and bases are loaded, and the rain would come and you wouldn't leave, so then don't leave your sukkah either. I don't think that's true. I think the shir is the way Chazal said, which is, if you would walk out of this room because it's wet go into another room. That's when you walk out of the sukkah. Mitzvah is when the environment gives you difficulty, it doesn't allow you to function, then you're allowed to leave. Choyle sheyesh b'sakana is mitzvah. Yeah, he doesn't have to do anything. It's going to be affected by the sukkah. He doesn't go. He needs his bed rest. He's not going to go to the sukkah. If he wants to, he can, but it's not something that he's mechuyev to do. Yeah, we even sit in the rain. We push ourselves. Okay. Yeah. It's choylem and mishamsheim. Choylem and mishamsheim. And nobody really understands what's critical, what's not critical. Patients that have visitors always at their bedside seem to get better service. There's a p'tur of cholim and mishamsheim. Obviously, if you're not necessary and there's already people there and you could slip out and go to the sukkah, you should. And the same with nursing care. If a person realizes there's enough staff on the floor, and if they go, nobody would stop them. If they would go out for a personal phone call and not think twice and spend 10, 15 minutes, so then, go to the sukkah. Treat it the same way as you would treat any of your other personal needs. If your other personal needs would take precedence over the mission that you're involved in, so then that's what you should do also regarding sukkah. Person doesn't have to use cholim mishamsheim as a p'tur. It is a p'tur if he's actually doing it.
Yeah.
So generally, those are not even, according to some poskim, those are not even the rabbanans. I'm saying we, based on a Gemara in Eruvin, there's 3 Gersos in a Gemara in Eruvin, but we adopted the Mechaber's Psak, where he holds that you could do the Rabbanan through a non-covenantal, through a Nachri. You could do a Rabbanan for a mitzvah, any mitzvah, not dafka mila. The gamut of shittas go in each direction, but we adopted the middle sheet, which is you could do a shvus of the Rabbanan through a Nachri. Now, if you think about it, pressing the elevator, or letting a person out through a key card, according to many poskim, they don't even really know what the Isser is. So of course you could do that on Yantiv, on Chol Hamoed, on Shabbos. In order to be Mekayim the mitzvah of Sukkah, of course you can. And of course to get back in, you need to do what you have to do. That's also a mitzvah. So there's no Isser going out, there's no Isser going in. And it's the right thing. It's the right thing. Those are, the halachas of Sukkah are complicated. There used to be Rabbanim that would go around neighborhoods investigating sukkahs because the layman's understanding of mechitzas is weak. It's Eruvin, it's Sukkah, it's Shabbos, there's a lot of big sugyas. For the most part, there is always kimat a shita to rely on. So eating in that sukkah, it's better than not. But if you have like real shilas and you can't get a picture to somebody and you can't, and it's a reasonable shilas, so you don't make a bracha on such a sukkah. You don't make a leishiv, but you should certainly sit there, because for the most part there is a shita that you're going to be yaitza. The big shilah that a lot of people deal with is walls that are not really attached; they shake. So there is a din in Shulchan Aruch, and Chazon Ish was very machmer that a wall that shakes more than 9 inches, 3 tfachim, would be a pasul sukkah, and you wouldn't be able to make a bracha in it. There were those that disagreed. Rabbi Yosef Chaim Sonnenfeld held that that's okay. When there are straps on the bottom, that creates a lovet situation. It makes the sukkah much, much better. When the sukkah is anchored and the walls are tied down tight, it's also an additional benefit. So the outcome is that you should use such a sukkah. If you have a shaila, if you see it's put together very flimsy, then maybe don't make a bracha for the most, but leisha b'sukkah. But other than that, use it.